This is week 10, part 5. Cardiac stimulation equipment. As you know, the ventricles are the major pumping chambers of the heart. The right ventricle pumps blood to the lungs, and the left ventricle pumps blood to the rest of the body. Ventricular fibrillation is an arrhythmia. This means that the ventricles are quivering instead of pumping strongly like they are supposed to. When the ventricles quiver instead of pump, they don't supply the body with enough blood. So when the patient is in VFib, they need to be defibrillated. So the defibrillator is what's used on them. A defibrillator is a machine that delivers a shock to the body. This shock terminates all electrical activity of the heart so that the natural pacemaker can restart a normal rhythm. The natural pacemaker of the heart is called the SA node. That is what begins the electrical impulse. So again, you need to review the electrical system of the heart, know that anatomy. Here is a picture of internal defibrillators used during open heart surgery. There's the paddles. There's the paddles being used. Then, of course, external defibrillators. Those are the ones that on the crash carts. Okay, moving on to a temporary pacemaker. So this can be a transvenous internal pacemaker or an external pacemaker. Both are used in emergencies and or until a permanent one can be inserted. EP stimulation, electrophysiology stimulation. At least 3 electrode catheters are inserted via a vein, either femoral, subclavian, internal, jugular. Each catheter is placed in a different place in the heart. For example, right atrium, right ventricle, coronary sinus. The electrode catheters stimulate the heart muscle and then record the heart's response to the stimulation. Then you have permanent pacemakers. Reasons why a person needs a permanent pacemaker is symptomatic bradycardia. So if they are blacking out, syncope, passing out, dizziness, because of a slow heart rate, they might need a pacemaker. Heart block, that would be meaning the electrical impulses from the atria aren't getting to the ventricles whatsoever. So this complete block in communication between the atria and ventricles. There's a block in the signal. Sick sinus syndrome, that is, it alternates between slow and fast rate. So again, that's an indication of heart disease or disease of the heart that it's not functioning correctly. You might need a pacemaker for atrial fibrillation, and you might need one after you've been put on beta blockers. Beta blockers are medicines that slow the heart rate, and again, it could slow it so much to cause symptoms. Then you have the implantable cardiac defibrillator. These are inserted in patients that are deemed at risk for ventricle fibrillation. So these devices are able to detect if the heart is in VFib, and then it delivers a shock.